we're going to address an introduction to the human body. The first item is, how do we study the human body? In what position? There is what is called a standard anatomical position. Let us remind ourselves that we usually learn small ideas and then we make it larger. So we cannot put in our head very large detailed idea at once, and we need to learn more so that this idea gets bigger and bigger. The starting point is learning 4 or 5 essential facts about a subject, and then you start adding more facts to the subject until the idea shines. When it shines, that is meaning that you have understood the idea. Once you understand the idea, you will never forget it, and it will be very easy to answer in the exam. This is the policy to success. Small ideas, when you work on them, they get bigger and bigger, and then they shine. And you are supposed to fill your brain with lots of shiny ideas. That is very wise, and that will make you a very good professional person. Do not fill your brain with small ideas, because this is a recipe for being simply an ordinary or inefficient professional. Growth and expansion of ideas come from reading books and other sources, because nowadays in the 21st century science is everywhere. This is your textbook. It is The Principles of Human Anatomy by Gerard Tortora. Why have we chosen this textbook? Because it has easy language, objectives are very clear, it has great images, and a chapter summary where you can start your study from there, and it has sample questions. How do I study anatomy? Since anatomy is visual and descriptive science. Therefore, this is what I'm going to do. What do I do now? The answer is going to be easy. Study an image. I have to. Never study anatomy without an accompanied image. Studying dark lines on a white paper will not be good enough. So start with studying the naming of structures. Write down your notes on a piece of paper, and then you will find yourself that you have learned a lot. Here is a person standing up in standard anatomical position, or what is called normal anatomical position, that is universally agreed on. So why should we know standard anatomical position? We know that so that we will be able to clearly talk about different parts of moving organisms. The human body is a moving human being, and when we want to describe a structure, we have to put it in the normal anatomical position. So the terms will be well understood all over the world, because no matter how this person is moving and in what position the person is. Now, where do we start? We start by the fact that the body is in erect position, not sitting or lying down, and the head is straight, eyes are looking forward, and the upper limbs are on the sides of the body, and the lower limbs are standing side by side, and the feet are flat and straight on the floor. I'd like to go to some details of the position of the hand. The palm of the hand is facing forward towards the observing person. It is not on the side of the body, and the little finger is nearer to the body, and the thumb is away from the body, a term called lateral. As we have just finished our description of the standard anatomical position, now, according to the rule, we should write down our notes. Now, the subject here is in anatomical position, what is called the standard position of reference. We have seen that the body is erect, facing the observer, head level with the observer, that means it is directed forward, eyes facing directly forward, lower limbs are parallel to each other, and the feet are flat on the floor, and the upper limbs are at the sides, and the palm is directed forward. This position of the human body is called the supine position, lying at the back. This is the position of the physical examination of a patient. We do not examine patients while they are standing up. Now, the supine position, the upper position, is the position that the patient takes while he is being examined, and the lower position, what is called the prone, where the abdomen and the thorax are lying on the bed and the head on the side. This is called the prone position. It is also used in physical examination of the posterior or the back parts of the body. Now we should write our notes about what we have just seen. The supine position is lying down and facing up, the position of physical examination, and the prone position is lying down and facing down. We have other positions that are used when patients have certain conditions and therefore they are placed in special positions. We have the Fowler's position, like sitting down but inclined a little bit to the back, and we have the Trendelenburg position, where the head is down and the feet are up. This figure summarizes the different positions that a person or a patient may take. In this slide, we can see that the central idea that anatomy has different branches. The top one is the gross anatomy, which we will be talking about. Then there is anatomy of X-rays, radiological anatomy, then there's pathology, then regional anatomy, anatomy of a specific area, then systemic anatomy, anatomy of a system. Sectional anatomy is when we slice a part of the body, what do we see? Surface anatomy is the position of an internal organ from outside. We will be talking about histology when we talk about basic tissues. Now, the cell biology you have already studied. Developmental biology you have also studied, and there is the science of embryology, how the human body develops. This is a diagram of the levels of organization of the human body or any animal. It starts with atom, something you have studied, then atoms produce compounds or molecules, and molecules produce organelles. Organelles are specific structures inside the cell that will do a specific function, like nucleus or endoplasmic reticulum or mitochondria. Then you have studied the cell as well in your biology. Now here we are going to start studying tissues, organs, and organ systems and organisms. Now, tissues are group of cells that have similar structure and function. An organ is a group of tissues, and a system is a group of organs, and the organism is a group of systems. Now let's write down our notes about studying levels of organization. Now the body consists of 6 levels of structural organization: the chemical, cells, which is the basic unit of life, tissues. Tissues are a group of similar cells that join and form specific function. Organs are one or more tissues joined together to perform a specific function. A system is groups of organs. The group of organs will create a system, and group of systems will form the human body. When you look at this image, to your right you will find the complete human body, and to your left is the atom, then molecules, organelles, cells, tissues, organs, organ system like the digestive here, and then different systems will make the human body. If we look at this apple, if you look at it from outside, we see it's rounded, it has two colors, and there's a stem at the top. Now, what is the anatomy of this apple? Now, to study the anatomy of this apple, we have to section it, we have to slice it. On your right, when we sliced it, we notice that there is a system on the inside containing seeds, and it is having a heart shape, and there's a depression here with the kind of dried flower. When we cut the apple in cross section, we can see that the inside system in more details. We can see that there are seeds and there are areas that house the seeds. Therefore, we could not see it from outside, or we cannot see it as clear as this in longitudinal section. Another example of having a section through cutting this red pepper into two halves, and we can see the internal anatomy, something we cannot see from outside. This is a cross section of an orange, something you are familiar with, I'm sure. After we have seen these examples, when we study anatomy, we do sectioning of the body so that we can see what is inside and what is the relation between a structure or another. If we slice it into two equal halves, right and left, then it is a sagittal plane. If we have a coronal plane, which is going to divide the body into anterior part and a posterior part, and when we cut the body transversely, we have an upper part and let's look at another examples of planes of the body used in anatomy. We have a sagittal plane, and a sagittal plane equals right and left parts. Then there is another type of plane which is called frontal plane, and we can use another term and we call it coronal plane, and this is equals to anterior and posterior parts. Then we use another plane which is called a transverse plane, and this is equal to upper and lower parts. Now, after we made our observations, we write our notes. Planes and sections, they are imaginary flat surfaces that pass through the body. We have a sagittal plane dividing the body into right and left. We have mid-sagittal, and it is also perpendicular, but it is exactly in the median plane, equal right and left halves of the body. Parasagittal plane is a plane, it's a vertical plane, but divides the body into unequal unequal parts of the body, and you can see that this arrow compares the mid-sagittal with parasagittal. The mid-sagittal is in the median plane. Parasagittal divides the body into unequal halves. The frontal plane or the coronal plane divides the body into anterior or ventral and the posterior or dorsal sections, and the transverse is easy. It's superior and inferior body parts. The question now is whether the human body is solid or does it have cavities. The answer is yes, it has cavities. Number one is the cranial cavity where the brain is. Then the vertebral cavity where the spinal cord is, and it is protected by the vertebral column. So the cranial cavity and the vertebral cavity are on the dorsal side of the body, that is posterior side of the body. Then we go anterior to the vertebral column where we find the thoracic cavity, which houses the two lungs, one on the right and one on the left. And then we have the abdominal cavity where you find most of the organs of the gastrointestinal tract, and the diaphragm separates the thoracic from the abdominal cavity. Lastly, at the bottom of the abdominal cavity there is the pelvic cavity. Pelvic cavity is continuous with the abdominal cavity. Now, when we look at the right figure, we can recognize the cranial cavity, then the vertebral cavity, and as we go into the chest, we see what is called the superior mediastinum. This is not a cavity but an area of loose areolar tissue and contains many organs, and below it is the pericardial cavity where the heart is, and then the diaphragm, and we can see the abdominal cavity, the largest of the cavities, and the lowest part of it is the pelvic cavity. Study this lateral view of the human body and write your notes about body cavities. The ventral body cavities are lined by a membrane. The dorsal body cavities are lined with other kind of structures. Now, the ventral body cavity, in fact, it does not have any structure inside it, but structures like lungs, heart, intestine, they invaginate into these membranes. Like an example which is presented here, like a balloon, and a fist of a hand is pushed into the balloon. The hand is not inside the balloon, it is invaginating the membrane. This kind of membrane lining a cavity which does not open to the outside is called a serous membrane. What is another kind of a membrane? The other kind is a membrane that lines a cavity that opens to the outside, like the membrane lining the mouth or the nose. Therefore, this is what is going to happen. The organ is going to invaginate into the balloon or into the lining serous membrane, and the result is this. There is a membrane lining the walls of these cavities, and this is called the parietal, the one at the periphery. Then at the point of invagination there is a reflection of the serous membrane, and the serous membrane starts to line the organ, whether it is a lung or a heart or a small intestine. The one at the periphery is called parietal membrane, and the one covering the organ is called the visceral part of the membrane. A visceral means an organ, and the space between the parietal and the visceral contains usually small amount of fluid for lubrication, because the invaginating organ is usually motile, like the lung expands and recoils, the heart beats, and the small intestine gets distended and moves around in the abdominal cavity. Study these two figures. The one on the right is where the fist of the hand is invaginating the balloon, and you can recognize the parietal, the point of reflection, and the visceral. And on your left it is the heart invaginating its own serous membrane, which is called the pericardium. It has a parietal pericardium and a point of reflection, and visceral pericardium, the part of the membrane stuck to the wall of the heart. The nose is a cavity in the face, but because it is opened to the outside, its lining is called mucous membrane. The mucous membrane contains mucous glands, and these mucous glands, they lubricate the cavity and the surface, and excess of it comes out. This image is telling me that the body has different regions, and each region has its own name. These names are popular. Most people know these names, but only certain areas, which we will address when we continue our study. Have a look at this image and see which area is called what. Now we have seen few images now, and we studied them. Now we need to write our notes. Now, the major regions of the body. The head has two major regions. The cranium, the part that contains the brain, and the face, the anterior part of the head. Then the neck. Everybody knows where the neck is, and it is in fact a modified portion of the trunk, the uppermost constricted part of the trunk. Then the trunk includes the upper portion, the modified part, the thorax, the abdomen, and the pelvis. The upper limb regions are also called upper extremity, and it includes the shoulder, that is common knowledge, armpit or the axilla, the arm, the forearm, the wrist, and the hand. The lower limbs or lower extremities contain the buttock area, which is posterior, and the groin, which is anterior, then the thigh above the knee, and the leg below the knee. Ankle is the joint before the foot, and then can see the foot. Now let us address the directional terms, which are a bit too many, but we will try to make it as easy as possible. First of all, we draw a midline of the trunk, of the head, the neck, and the trunk. Now, anything Now, let us address the directional terms, which are a bit too many, but I'll try to make them as easy as possible. If we look to the left, we draw a midline through the head, neck, and the trunk, and anything nearer to the midline is called medial. Anything away from the midline is called lateral. So in reference to the midline, the nearer one is medial, and the further away from the midline is lateral. Anything towards the head is called superior, and anything lower down is called inferior. So in the figure to your right, here the face is looking forward in normal anatomical position, and the palm of the hand is facing forward, and anything anterior to the body is called anterior or ventral. Anything at the back is called posterior or dorsal. Anything towards the head is called superior. Anything lower down is called inferior. Anything nearer to the trunk is called proximal. Anything away from the trunk is called distal. Now we need to examine the abdomen through the abdominal wall, and there are several organs distributed all over the abdomen. The first step is to use the 4-quadrant system. A line in the middle going through the umbilicus, and a line going transversely going through the umbilicus. So the abdomen at the surface is divided into 4 quadrants. This is the right upper quadrant, and this is the left upper quadrant, and then right lower quadrant and left lower quadrant. The physical examination of the abdomen, the doctor usually starts with this system to have a general idea. If you look at this image, we will find that, for example, the stomach is in the left upper quadrant, the liver and the gallbladder is in right upper quadrant, the beginning of the large intestine and the appendix is in the right lower quadrant, and small intestine and part of the large bowel is present in the left lower quadrant. Now we will be more specific in palpating the abdominal organs. So we are going to divide the anterior abdominal wall into 9 regions. These 9 regions are going to be divided by 2 vertical lines coming from the middle of the clavicle going down. These are 2 perpendicular lines, and then we have 2 horizontal lines, one going through the costal cartilages of the thorax, and the other one is from anterior superior iliac spine to the other. The result is 9 regions. Starting on the right, this region is called right hypochondrium. Hypo means below, chondrium means the cartilage. So this is the right hypochondrium. Right lumbar, it is because this region is to the side of the lumbar vertebra, and the lowest on the right is the right iliac fossa. It is in the iliac fossa of the pelvic bone. Left hypochondrium, for the same reasons, left lumbar and left iliac region. Then we come to the central 3 areas. The epigastric region is the upper middle one, where the stomach is located. Then we have the umbilical region around the umbilicus, and then the hypogastric region or the suprapubic region. This is a comparison between the 4-quadrant system and the 9-region system, and you can go through each quadrant or each region and you can see which organ is present in which region. Compare your notes you have written about the previous slide and see here whether you are right or wrong. Now, if you look at the liver is in the right hypochondrium, hypogastric, and reaches the left hypochondrium. The transverse colon in a standing position is usually in the umbilical area. The stomach is in the epigastric and left hypogastric area. The small intestine is usually in a standing normal anatomical position, is in the umbilical, the hypogastric and the left iliac fossa. Now we have seen so many things and we have studied so many pictures, so we need to write down our notes, the very essential notes. This is a mind map written in a software called Free Mind. If we follow the center introduction, we go through the pink line, and there's a rectangle around what is anatomy. Anatomy, just follow the lines. Anatomy is a study of what? Of structure, plus relationship among structures, plus how they work. That means functions of the body part, that is the physiology of that part. And anatomy is descriptive science. These are the very essential facts of the definition of anatomy, and it is represented as one arm of the mind map. These lines very easily, right? We have also studied body cavities. What is a body cavity? Body cavities are spaces within the body. Why do we have cavities? For the following reasons. And we have cranial cavity, vertebral cavity, thoracic, pericardial, and abdominopelvic cavity. The abdominopelvic cavity is including thoracic and abdominal cavity membranes. Not only that, but pericardial cavity also have a serous membrane, but the branching has stopped. I will provide you with a full mind map of all these structures. Now, these serous membranes lining the thoracic and abdominal cavities are what? What is a membrane? Is a thin, pliable tissue, covers and lines and divides and connects structures, made of one layer of cells, which is very thin, made of mesothelium, plus a basement membrane. What is a serous membrane? It's double layered, as we have seen, covers the organ is the visceral layer, lines the wall is the parietal layer. Parietal and visceral membranes, they meet, they are continuous with one another, okay, and they create a serous sac, has little amount of fluid. Serous membrane of the lungs is the pleura, of the heart is pericardium, and of the abdominal cavity is the peritoneum. This is a description of the standard anatomical position. Describing it, just follow the lines and you will remember all the images. And here it is written in the form of a mind. Body regions, we have gone through that and you remember the images. What is the trunk? The trunk is made of the chest, the abdomen and the pelvis. What is the upper limb or upper extremity? It is attached to the trunk. It's made of shoulder, arm and axilla, forearm, wrist and hand. Just simply follow the lines, please. Then we have the directional terms. Now, I think I have described it on the images and they are clear, but without these images, if you study this mind map, it's hard to remember. What are directional terms? These are words that describe what? Position of one body part relative to another. Superior يساوي above, higher in position. Now if you remember the images, there were two arrows drawn on the right with the head of the arrow up, that is superior, and the head, the lower one, the head of the lower arrow pointing down, that is inferior. Anterior is at the front of the body, posterior is at the back, ventral that is also anterior, dorsal is posterior, medial is nearer to the midline, lateral is farther from the midline, proximal and distal are related to the trunk, superficial and deep, whether they are near the surface, the structure is superficial. If it is down deeper, then it is deep. External and internal, whether towards the outside of the structure or towards the inside of the structure. Abdominal regions, we have the 9 regions system and the 4 quadrant system, and they are not farther away from this point of time. We have just described them, and these are the notes you can write about these two systems. Reading this mind map or any mind map, just follow the line. Thank you.